what is gout, and what is the standard treatment of care for it?
Sure. And that's actually very timely, because we're always modifying our recommendations. And so, the American College of Rheumatology just came out in 2020 with the recommendations for treatment of gout. The feeling in rheumatology about gout is that it's not an episodic disease. So in the past, people have looked at gout as you have a red hot swollen toe, and you just treat that episode. And once that episode goes away, you don't have to worry about the gout in between. It's sort of only when the person has pain. And that's completely opposite of the way we think about gout now. We know this is a chronic inflammatory disease. It affects the whole body. And all of those things that go with chronic inflammation come from that as well. So heart disease, we start to see other metabolic problems, even weight gain and things like that that are contributed by this chronic inflammation state. And so the standard of care has changed from an episodic treatment of gout to one that's actually sort of prophylactic. It's managing it like you would manage somebody's high blood pressure. Manage their high blood pressure before they have their heart attack or their stroke. In this case, you manage the gout attacks, you manage those before the person gets the complications. And now, the American College of Rheumatology says that we should treat these patients that have gout, particularly if they have elevated serum uric acid levels or they have tophaceous deposits, which are those deposits of gout under the skin that sometimes you can see in patients that have refractory gout or gout for a long time. And we treat those more aggressively with a daily medication to help bring that uric acid level down and ultimately try to prevent the gout attacks, but also the deposition of uric acid. And so that's what we call a treat to target approach. So you have a goal in mind, which is getting the serum uric acid below 6, and then you do what you need to get it there. So the first line is always oral agents, things like allopurinol. And then if you move past that where the patient still has gout flares, they're not at goal, then you escalate your care. Pegloticase, as we were talking about today, is for those chronic refractory gout patients. So the ones that can't get there with standard oral therapies, the ones that they continue to have gout flares, they continue to have tophaceous deposits. That's where we look at these more aggressive treatments. In this case, pegloticase, for those of you listening that don't know that medication, it's an IV medicine. It's given every 2 weeks, so it's not something that is meant to be given for forever. It's meant to be given in a short term to basically bring that person's gout back under control. And it's coming to an office to get an infusion every 2 weeks isn't as easy as taking a tablet every day. So that's why that medication is used for those refractory cases.